Senator Shaheen.
Thank you, Mr. Chairman, and thank you to each of you for your testimony today and your service to the country. Our office is still hearing, fortunately not as often, but still hearing from people who have been affected by anomalous health incidents. I don't know if this is for you, Dr. Martinez-Lopez, but can you speak to how the department's understanding of those incidents has evolved and to what extent you believe people who have been affected, both military members and their civilian family, are being treated now?
Overarching, ma'am, I mean, we need to take care of these people. They're sick. So when they come to our system, we have interagency agreement and we have processes to bring them. You help us out with that. We're going to take care of them. We're still doing research, trying to figure out the causality.
Right.
That's going to take time. But the overarching, like with anything, we need to take care of the people first. And then with the best science we have, develop the science as we learn more, close that gap, right? But it doesn't stop. So we're going to need the help from you to sustain that effort.
And what I have heard from people who have been affected is that they especially appreciate the care they're able to get at Walter Reed Medical Center. Can you tell me if Walter Reed is still open to those people who have been affected by AHIs, not just within the Department of Defense, but across the federal government?
Ma'am, we're very proud of that team, and I think the General can speak about that.
Yes, Walter Reed is continuing to care for AHI.
Thank you, and it will continue to do that.
And it will continue to do that. Yeah.
Thank you. So I maybe want to ask each of you this question. What percentage of your force are women? Admiral Gillingham?
I would have to get back to you, ma'am, but I believe it's approximately 30%.
General Miller?
Now, Air Force overall is 21%, and within the AFMS, it's 50%.
Thank you.
Ma'am, I'd have to get back with you the specific numbers.
Dr. Martinez-Lopez, across the entire military, can you tell me what it is?
I'm told 18%.
18%, and that number is going up, is that correct?
Yes, ma'am.
So that women make up a very important part of those who are serving on active duty. Perhaps this is for you, General Croston, what contraceptives are currently available to service members?
All contraceptives are currently available to our active duty women. The Defense Health Agency's rolled out a walk-in for contraception in all 133 of our clinics that offer that capability, to include some of the long-acting contraception, so they can walk in and be taken care of without a referral or an appointment.
And is that the case for people who are deployed overseas as well?
It is a case for the people who are deployed overseas when they have access to the capability within the theater. So if the clinic provides long-acting, then they're able to walk in and get long-acting.
And can you tell me what percentage of women are deployed in places where they can't get access to those contraceptives?
I do not have that number. What locations do not have the capability to provide it?
Is that something that someone within the office is able to provide?
We'll take that for action.
Okay. We hear from women on a pretty regular basis who tell us that they are in places where they don't have access to contraceptives. Service members and their families are affected by eating disorders at elevated rates compared to their civilian counterparts. And the SERVE Act was passed in fiscal year 2022 in the NDAA, and it was designed to expand access to eating disorder treatments for service members and their families. Can you speak to the options that are now available as the result of the passage of that, and has it been fully implemented? I guess this is for you, Dr. Martinez-Lopez.
Ma'am, I don't know the answer to that one. I owe you a response.
Okay.
Anyone else knows? Okay.
Well, thank you. I think it would be I would appreciate hearing that response, as I'm sure the full committee would, subcommittee would. And I think as part of that, it would be helpful to know if spouses and children of service members are provided the same level of care as active duty service members. Thank you.